So let's look at the structural classification of joints. All right, so in the structural classification, we're looking at the stuff that holds the joint together. So the substance that's holding it together. So we have three types. We have a fibrous joint, cartilaginous joint, and a synovial joint. So we're going to talk in depth about the synovial joint, so we'll set that off for later, but let's look at the fibrous and the cartilaginous because there's not that much to it. So in the fibrous joint, these are joints held together by dense, so connected by dense, irregular connective tissue. Okay, so examples of that are going to be the sutures, sorry about that, the suture. So this is what we see in cranial bones that hold cranial bones together. So there's dense, irregular connective tissue inside there. And then we've got the syndesmosis. So this is this area here, this little membrane called the interosseous membrane here. So this is the membrane between the ulna and the radius. All right. And then the gomphosis. And this is basically the tooth in its socket. Okay, so there's a socket here, there's the ligament called the periodontal ligament that holds that in place. So by and large, these don't move a lot. This is a synarthrosis. Your cranial bones don't really move at all. The syndesmosis here is an amphiarthrosis because there's a little bit of movement with pronation and supination of the forearm. And hopefully your teeth aren't moving around. These are synarthroses as a gomphosis. Okay, so we have these structural classifications, and then we can still put them in the functional categorization or classification as well. So the cartilaginous joints, they're held together by some flavor of cartilage. So connected by cartilage. So we have a couple here. This is a synchondrosis. And this thing here, this is the a long bone in basically a child or adolescent, because you can see that the growth plate is still there. So in long bones, when the growth plate is still open, that is a synchondrosis. Once the growth plate closes, it's not a synchondrosis anymore because there's no more cartilage there. The costal cartilage, this is also synchondroses. So we've got hyaline cartilage that are connecting the ribs to the sternum. And the growth plate is going to be a synarthrosis. Your epiphysis isn't going to move around your diaphysis. But here, this is an amphi. Your ribs move a little bit to accommodate your ability to breathe. So when you take a deep breath, your ribs kind of raise up and expand a little bit and then come back down when you breathe out, and it allows you to take deep breaths. This thing here is called a symphysis. And these are the discs that are in between your vertebrae, made out of fibrocartilage. Okay. There's also a disc between your pubic bones, and that is also fibrocartilage. So basically that's it. Those are the fibrous joints, and those are the cartilaginous joints. So The rest of what we're going to talk about is going to be synovial joints.